Cozumel, Mexico. And next to us is MSC Seascape. Swimming pool. Let me put a scenario to you. So you are in the medical center, a patient comes in, the patient has a serious medical emergency, goes into cardiac arrest, you do the entire ACLS cardiac arrest algorithm, you achieve ROSC, patient comes back, now your patient is somehow hemodynamically stable, but on a ventilator. Now, before we talk about this cardiac arrest, let me give you the full picture for context. And this is a true story, something that happened to me several years ago. So from the beginning, this is a long cruise. This is a 21-day cruise starting in Sydney, Australia, and ending in Seattle. But you're gonna do many different port of calls, and the cruise is gonna be segmented into 3 different cruises. First part, Sydney, New Zealand, the Polynesian Islands, and you are gonna go through Bora Bora, Tahiti, and ultimately Hawaii. Arriving in Honolulu, you will spend some few days in the different Hawaiian islands, Kauai, Maui, Hilo, and after that, another crossing from Hawaii to Vancouver. And finally, the last part, from Vancouver to Seattle. Total days, 21 days. You are currently day 5. On day 5, so the first leg of this cruise, the first part, going across the Pacific from Australia to Hawaii. On day 5, all hell breaks loose. You have an influenza outbreak. The numbers were already going up from the first 2 days of the cruise. There was a trend going up. Now it's day 5 and you've got a full-blown outbreak. You're sitting with 5% of the guest population having influenza and 3% of the crew population. So that's about 140 guests and 50 crew. So total number of affected people is just short of 200, 190. To make matters worse, you only have 2 doctors on board. One of the 2 doctors is sick with the flu, unfortunately. Caught the flu during this outbreak and now he's sick as a dog, isolated in his cabin, not doing well, fever, chills, cough, lower respiratory tract symptoms, just completely out of commission. Of the 3 nurses you have, you've lost 1 nurse because you had a medevac 2 days ago. Helicopter came, took the patient was really unstable, and so a nurse needed to disembark with the patient. So you're currently sitting with you being the only active doctor on board and 2 active nurses. Day 6, you're in the middle of the ocean, an ongoing outbreak, and there is an emergency call, a medical emergency for a 67-year-old gentleman in cardiac arrest. You rush to the site, to the guest cabin, and you start CPR, you go through your cardiac arrest algorithm, with the other 2 nurses. Patient is brought to the medical center. It's a long resusc. You give the patient everything, epinephrine, amiodarone, the works. You achieve ROSC. The patient is in a coma. You follow your ROSC protocol. You're inducing hypothermia. The patient is on a ventilator, but you only have a little portable ventilator. Your patient is intubated, sedated on that little portable ventilator, receiving IV drugs. You're giving that patient support. It is day 6. The weather is not great. There is a massive storm system preventing any possible helivac. There's a storm system. The wind is just too much. Things are just not good. So you're going to have to stay with your patient until you get to Honolulu, or at least until the weather improves. But you know, you're 2 days away from Honolulu. You're 2 days away from any type of land. So even with clear weather, a helivac is just impossible. After discussion with the Coast Guard, you know, at the bridge, the only course of action is for you to keep your patient in your RCU for the next 2 days, on a ventilator, sedated, intubated. Now, 4 hours in, your ventilator fails. You know, the ventilator had some problems from the beginning, you know, like a circuit adapter was malfunctioning, and you know, you've placed an order, you've notified shoreside, it's been some time, and they promised you that, you know what, by the time we get to Honolulu, we'll get the parts that you need, or at least maybe a new ventilator. But right now there's nothing you can do. So your ventilator fails, your patient is now on manual ventilation with an ambu bag, and you're gonna have to bag that patient for the next 2 days manually. So you're assigning people to do that, you know, like every half an hour you're trying to do some changes, you know, so that the staff, crew members, you know, I mean, you're just on the spot teaching people how to ventilate, and they do it on the spot. 8 hours later, or let's just say hour 8 from the moment this patient was in cardiac arrest, with another medical emergency. A 28-year-old woman, not known diabetic, who comes in DK, diabetic ketoacidosis, GCS 3 out of 15. She's in terrible shape. You intubate her, sedate her. There's no ventilator. By the way, the medical center has a backup ventilator, but that backup ventilator is also out of order for now. So now you've got 2 patients needing to be bagged manually. You're running out of your medication, you know, your sedative, your vasopressors, you know, your basically all the medication that you need to maintain your patients under sedation, ventilated. Notwithstanding the cardiac arrest patient, who is stable as long as you continue with, you know, IV vasopressors, right? You start to run low on your medications. And according to your calculations, you will not have enough meds for 2 RCU patients ventilated, needing IV treatment, sedation, you know, vasopressors for the cardiac arrest patient. And it's just a lot. And on top of that, it's only the 1 doctor, you, and 2 nurses. And remember, you've got an outbreak with about 200 affected patients. Some patients are very sick, some patients are elderly. So your medical center is full, packed. Some people are just laying in the waiting area. Others, although they are not ICU patients, but they're in very bad shape, they can go back to their rooms. Some people are lethargic, dehydrated, multiple comorbidities. Then they're admitted for IV fluids, IV treatment, IV antibiotics for some, because some have pneumonias on x-rays. It's just a mess. And so you have to make a decision now. It is impossible to continue on this path, being overrun by the guests and the crew with this influenza outbreak. And remember, patients are also coming with other conditions. Some people have fallen, you know, slip and fall, and sustain different things. You know, you have a broken ankle that's there. You've got another person with a shoulder injury, you know, an anterior dislocation of the shoulder. And then you've got other patients that are not well. You've got somebody sitting there with a severe migraine. You've got another patient there who sustained some, I don't know, a burn injury at the galley. Life goes on. And you've got your 2 ICU patients. So you have to make a decision now. What are you gonna do? You still have 1 day and say 12 hours to go. 1 day and 12 hours. So about 36 hours to go. You need to make a decision. Of these 2 ICU patients, you're gonna need to sacrifice 1. Just because you overrun, you can't cope with the situation, you're running out of ICU medication for this case, for these cases, what would you do? Would you decide to sacrifice the 67-year-old cardiac arrest patient to concentrate your energy and your resources on the 28-year-old DKA patient? Or would you carry on and try to save them both? What would you do? Or would you try and keep on juggling in between the two emergencies and treat all the other patients that are in the medical center as well? Notwithstanding the fact that you might have a third emergency anytime. What would you do? If you want to hear more about that, join me on Patreon, where I discuss these in depth. Join me on Patreon for more stories about the cruise ship industry. See you there.